Hi, Valerie. Welcome. How are you today?
I'm doing well, thank you. Thanks for having me.
Oh, you're more than welcome. I'm so excited that you're here and so excited for you to share your story with our listeners and viewers. So, why don't you start off by telling us a little bit about yourself?
Okay, so my name is Valerie. I'm going to say I'm a mom. That's probably the biggest thing. A wife and a grandmother. Have two young granddaughters. Um, I am currently on medical leave, but I work at Johnson and Johnson. I'm not sure of the audience, so I work at Johnson and Johnson in ironically in oncology. So um, it just brought my day-to-day work life in right into the forefront for me. Um, so right now I enjoy things at home. I'm here with my husband who's retired, and we like to spend time together outside, walking, shopping. Yeah, I
Oh,
don't
that's
know.
that's awesome. And Valerie and I work together at Johnson and Johnson. I have to tell you all because many of you probably don't know her, but she's a great dancer.
You notice I didn't say that myself, right? You notice that did not come from me.
So my last memory of you when I was a scientist, we had an in-person meeting and we were dancing on the dance floor. And I remember the people were dancing, but I remember there was a time it was just you and I on there dancing. But Valerie is a great dancer, so that's
Life is short. You got to have fun. You got to make sure you enjoy it, right?
absolutely,
Yeah.
absolutely awesome. Well, thank you again for being here. And why don't you tell us your story of how you were diagnosed with breast cancer, what happened before the diagnosis, leading up to the diagnosis.
Okay, sure. I would have my yearly mammograms, routinely, but this particular time, it was probably at maybe October, November of 2023. In the shower, I found a lump, and it was so huge that I couldn't miss it. Just I wasn't looking for it. It wasn't a self exam, but it was so large that just in showering I found it. So when I first found it, I really didn't think anything of it because years ago, as a younger woman, I had several benign cysts that were removed, and they were not problematic at all. So when I first felt it, I thought, oh, here it comes again. All these years later, it's back to haunt me again. And so I have to say, I didn't put any urgency behind moving forward. I knew I needed to do something with it, but I didn't really put urgency behind it, right? I thought, oh, I'll just call and make an appointment when I think of it. And, each day would go by and I didn't do, I'll do it tomorrow. I'll do it tomorrow. And so finally I got it done, and I went to have the diagnostic done. My primary care physician ordered a diagnostic. And so, I went in and they said, um, oh, we need to do a biopsy. So I'm still, as I go through this, I'm thinking, okay, I have to do a biopsy, no big deal. This was the beginning of this year now when I finally got the series of appointments in place. And I still never thought anything of it. And um, a couple of days later, I get a call from the hospital, and someone called me, and I just will never forget those words. I still at night sometimes I hear them. I just could hear her say, "I'm so sorry, dear." And but the whole concept for me was so foreign that as she was telling me on the phone, I couldn't believe it. I kept saying, "You're kidding me, right? You're kidding me." Right? And I'm saying to myself, Valerie, who would kid you like this? No one would stop saying it, but I couldn't stop saying it because for some reason in my mind, I thought I was exempt, I guess. And I also thought that I had self-diagnosed. It was no big deal. It was a benign cyst. So when she told me this, it just didn't compute. And in those first few moments, that my immediate first thought was my daughter and my granddaughters, and I thought, oh my God, I'm never gonna see them dance in the be ballerinas or whatever. That was my first thought. That I went from disbelief to not only didn't I believed it, but I also thought, oh, by the end of the year I'll be gone. And in my head, I'm not an overly dramatic person, but in my mind, for some reason, I just thought that. That's what I thought, and it was horrible. And I just cried and cried and cried for several days. I just sat in my house. I didn't get dressed or anything, and it just took a really long time for me to wrap my hands around it and accept that this was me. Um, and my mother had given me a photo of myself as a young girl, Um, and it sits on, I like pictures, so it sits on my table downstairs. And I couldn't look at that picture of the young Valerie because I thought, and it's so weird now when I think about it, but that looking at that picture, I just thought that little girl doesn't know what's ahead for her. And I couldn't stand to look at it. I told my husband we have to put it away. I can't look at it anymore. It just was a really, really rough time in the beginning. Yeah.
Yeah, no, thank you so much for sharing that. And you said so many key things there. One is that you were in the shower and you were kind of like self-diagnosing, like, okay, yeah,
Hmm.
I have a lump, and never thinking anything of it. But you said it was big, and then, getting it checked out. But your reaction to the phone call, um, I think is very interesting because, like, you work in oncology, we know about cancer, people with cancer, but it's like, not me, right?
Exactly. Exactly.
What are you saying? Like, what,
Hmm.
like, and that's the thing I always tell, like, healthcare providers is that, as an oncology nurse practitioner, we do it all the time. We're talking about it, we're treating it, we're doing all the things. But when it comes to talking to a patient for the first time, this is so life changing. It
Hmm.
should not be taken so lightly.
Hmm.
But yeah, like when you hear those words leaving someone's mouth to your ears, it's kind of like, wait a minute, like
Yeah.
automatically you start thinking, well, and that's like can't like the C word, right? That people say you don't want to say.
Yes.
You just
Hmm.
think equate
Hmm.
cancer to death, right?
Hmm.
Um,
Hmm.
even though there's so many treatments and things that are
Right.
being done, but I think that that's definitely a normal reaction. I think,
Hmm.
to say, yeah. Um,
And I
I
wonder for myself if
Mhm.
I had waited longer. So at my time of diagnosis, I was stage 2, but sometimes I wonder what would have happened if I would have just backburnered it until I was like, would I have been stage 3 or worse, you know? So
Mhm.
it definitely taught me a lesson, and that's something that I like to share. I want to make sure that I share because I was so convinced it was nothing. And so I think that's important for other people to note that we have to let the professionals and the experts, and even if we are ourselves, sometimes we are the worst ones, right? We have to make sure we let someone else do their job with us, right? So,
Yeah. Did you
mhm.
share it with anyone else before you went to the doctor? Did you share it with like your husband, a
Yeah,
friend? You did?
yeah.
And what was their reaction?
So I told I told my husband, and I told my daughter, and my daughter's my husband didn't react at first, but my daughter's immediate reaction was, "Oh God," that's what she said to me. But then even she calmed down because she remembered that I had gone through this twice younger, and herself when she was 18 had a benign cyst removed. So I
Mhm.
think we all were kind of lulled into this false sense of security.
Mhm. Mhm.
And then as you go through the process and you do like the scan, the mammogram, and then the scan, and then the biopsy, and you have to keep going through each step, there's a little voice in my head saying, "Oh, I thought by now I would have, we would have opted out because we would have said, oh, it's nothing." So when we got all the way to the biopsy, I'm thinking, oh, there was a little voice that said, wow, this is going all the way to the end, right? But I still didn't think it would be me. I just thought it was that
Yeah.
return. Yeah.
And it was like it's different this time. Like, wait a minute, it's taking a little longer, right? Like
Mhm.
the whole
Mhm.
process. So I think
Mhm.
that's really important too, that you actually seek out, even if it's small, right? If it's not big,
Right.
if it's something that's abnormal,
Right.
definitely get it checked out. And that's why I always I advocate for doing breast exams, or even just knowing your breast, right? Let's not
Mhm.
say breast exams, but
Mhm.
knowing your breast, knowing your body, and if something's off, get it checked out and let the professionals say there's nothing to worry,
Right.
you
Let
know?
the professionals let the professionals
Yes.
do their thing. Right. Yeah.
Yes, no, absolutely. And then, so you were diagnosed, and in the picture, the picture story you said was very interesting about the little girl didn't know what was ahead. I thought that was very powerful, very, very powerful. Did you have any genetic testing?
I did not, and I still have the option to get it done, but I have not done it. I had a conversation with them about that, and they asked me my history and um my family history with breast cancer, and I'm not an immediate candidate for it because
Mhm.
my mother did not have it, my sister does not have it, and I am, and so they said, you have to have those one of those components, to put you in that realm. But the option is still there because my family does have some history of. My sister has something called carcinoid tumors, which is kind of intestinal. So I could go that route, and then they would throw in the breast cancer. But on its own, I'm not a candidate.
Okay. Okay. And where are you now? Like, what kind of treatment did you go through, and where are you now?
So I started off with 6 rounds of chemo. I've completed that. I just completed a month of radiation. I also had surgery. I had a lumpectomy, not a mastectomy. And I'm still getting targeted treatment that will continue until February. So that treatment is for a year. So I have HER2 positive breast cancer. So the targeted therapy is a 1 year regimen. Yeah. So that's every 3 weeks IV infusion. But I'm doing well now. I think everybody knows the worst part of it was the chemo. I mean, and I don't know how I got through that. And oftentimes at work you will hear this patient felt, dropped out of the study. And I remember times thinking to myself, why would somebody drop off a study if you're getting treatment that might cure you? But honest to God, I think if I had to go more than 6 months, I don't know if I could have done it. I don't know if I had it in me. I just would, the pain was excruciating. There were days I was screaming for my husband to please help me, please make this pain go away. Just the overall sickness, and I couldn't eat any food, and I'd have sores in my mouth. I couldn't, there were most foods I couldn't eat unless it was very, very bland because the sores in my mouth were so bad. It was hard to even speak. It just was horrific. And I feel like just when you were about at your wit's end, then I was finished with the chemo. So thank goodness.
Yeah, so now you have a different perspective of looking at people on the
For
study.
sure.
We work in research and development, so that's
For
great
sure.
to be able to be an advocate, when you get back to work to say you
Hmm.
have a perspective of
Hmm.
the patient's experience.
I totally get it. I totally get it. And I think another thing that came to mind for me is to make sure that in the early days of your diagnosis, that you can get whatever information, as much information available to you as possible. Because what I found out that in the absence of information, your brain starts to fill in on its own,
Mm,
and whether it's accurate or not, it fills in. And it's not pleasant thoughts. So I think as much information up front that you can get from your caregiver is helpful. Because I think, for me in the beginning, I was diagnosed in a local hospital, one of these like neighborhood hospitals, and there just was not a sense of urgency there. I went for the longest time that I didn't see anyone, that I didn't know my stage. So like I said, my brain started to fill in, and then I transferred. Thank goodness that I work where I work, and everyone helped me to find someone there at Penn. And they were so much more aggressive. In the early days, boom, boom, boom. We're going to get tested. I remember being at my local hospital, and there was something under my armpit when they did the biopsy that they didn't like, and I could hear them like doing the scan, and they kept saying, "Well, do you see that under the pit? Do you see that? Look at the right side now. Look at the," and they were going back and forth and back and forth, but no one ever said anything to me. I went to
mm.
Penn, and inside of the first week, they said, "We think the cancer might be in your lymph nodes." Well, I mean, I didn't want to hear that, but obviously, if I needed to hear it, I wanted to hear it. And I was thinking, when were these other people going to tell me that that it was suspicious? Like they just looked at it and went, and that I never heard another word. So you have to be in the right place. You have to be with people that are aggressive, that are going to get the questions answered quickly. I mean, those to me were some of the standout things. Yeah.
I think that is so important because many times people are treated by their community hospital or local hospital, or they have their doctor, and
Mhm.
they don't want to hurt the doctor's feelings, right?
Mhm.
When you're
Mhm.
dealing with your health, it's always important to feel comfortable. It's urgent, right? We're talking about
Yes.
cancer, and get
Yes.
a second opinion at an
Right.
academic institution or people who specialize in this. It's not
Mhm.
about feelings, it's about getting the treatment that you want. And you also did something else that was very important, the people you work with. So you had to go and say something that something's not right, or I need, so sharing your story, asking
Hmm.
for help, asking for recommendations, using your resources is so important in a time like this, or anything, right? If you're sick, or
Right.
if you're not feeling well, if it's cancer, but saying, hey, I know you're in oncology. What do you think? Right? Is there
Absolutely.
somewhere I
Absolutely.
should go?
Hmm.
So not feeling ashamed. 'Cause I know sometimes people feel ashamed. They don't want to bother people, or but no, this is you need to bother people.
And make yourself a priority, right? Yeah. Hmm.
Absolutely, absolutely. Valerie, is there anything you would say to healthcare professionals in oncology that we could be doing differently or better to help in terms of the diagnosis, the treatment, where you are now? Is there anything, any experience you had that you're like, this could have been done a little better for someone, the next patient coming in?
I don't know if I had anything that would say could be done better, but I think the things that were done for me that were important, and that I would wish for everyone, would be that sense of urgency.
Mhm.
And once I got to the right place, I mean, my first appointment was with the breast surgeon. She, and the oncologist, and they mapped out my treat. I knew from day one what my treatment plan was going to be. They also talked to me about, the type of cancer I had, and the likelihood of success, and I think that was really important. Because you do have all these questions and you want to get answers. And I think that's super duper important. Also, I think what's important is, that to make sure that they are going to look at the whole person. And I mean, obviously the cancer is important, right? But they look at the whole. When I walked in, I'm also diabetic and I'm a chronic hypertensive. So I was wondering, how am I going to manage all this? How am I going to manage my diabetes? How am I going to manage my blood pressure? And so on my first appointment, they said to me, do you have a cardiologist? I said, yes, I do. And they said, well, we want to replace your cardiologist with our cardiologist who is experienced with these, cardiac agents that were, because we're going to hit you with some big agents, and many of these can have cardiac implications. And so we want to make sure that you don't just have a cardiologist, but you have a cardio oncologist. So I
Mhm.
thought that was super duper important, because yeah, what if that would have been a problem? You know what I mean? And so I think those are the things that you want to make sure that the caregiver really listens to every care provider, listens to every issue that you have, and that they focus on the entire person and not just specifically the cancer.
Yeah, absolutely. That holistic approach is so
Right.
important. And
Hmm.
they're not just treating the cancer or your breast, but even your
Right.
mind, right? Were you
Right.
offered any like therapy or seeing a social worker? Because that's a huge thing in oncology where patients don't feel like that's addressed. Were you
Yeah.
offered anything?
I was offered a social worker within the first week, and I suffer from anxiety.
Mhm.
So this sent my anxiety right through the roof. I was having panic attacks. I was not sleeping, and they did set me up with I say mental health, but it was a team of folks there at Penn that I was able to meet with, and it was really great because I could do it virtual, so I didn't have to go down there. And I thought they were amazing because they helped me to uncover some issues that were inside that I didn't realize that were there, and only surfaced after, talking with them and speaking to them and talking through things. And, one of the things that I didn't realize that I was obsessing over was the fact that I have a year's worth of treatment. And I was worried that I would become a burden to those
Mhm.
around me, because I mean, it's, if somebody has the flu, okay, I'll be over for the week and I'll sit with you, I'll bring you. But a whole year, I was thinking, who the hell is going to stay in this fight with me for a year? And that was something that I was worried about, but I didn't even really, I wasn't able to articulate it until I met with them, and they helped me to articulate it. And so we were able to work through those things. Yeah.
That's amazing. Well, kudos to Penn. They're doing it right. I love that.
Hmm.
I love that.
Hmm.
You said the cardiologist, then they did hook you up with someone. So Penn is doing it right. So kudos, kudos, kudos to them. Awesome. Well, Valerie, I know that because you are who you are and you're in R&D. Last time I talked to you, you were going to a conference.
Yes, yes, yes. So I received a care package, many care packages, but one of them was from an organization called the Pennsylvania Coalition for Breast Cancer. And it was a really nice package, had information, it had, creams and lotions and potions and lip chapstick and all those things. And then I got an invitation in the mail to their conference, and they said they would sponsor me for the conference. Well, all along I have been thinking, so I feel like I'm really, really fortunate. I got through the chemo. That was the worst part of it. I didn't mention I had my surgery, had a lumpectomy. My margins were clear, no evidence of cancer in the surrounding tissue. So, I'm going to win this fight. And I thought, I can't just go, okay, thanks everyone for helping me. Good luck, everybody else. And say I'm out, right? I can't. I feel like I was put on this journey for a reason. And the fact that I'm able to, I always struggle with how to articulate this. I'm not happy that I got the cancer, but I feel fortunate that I did, because I was able to go through this dark period, but I'm able to emerge from it. And I can take from it all of my lessons, right? And I feel at this point appreciate life more. The air smells sweeter, food tastes better. I'm going to appreciate those around me. Say what I have to say to people. I'm not going to take things for granted. Like, I think we all fall into that pattern. So I'm very fortunate to have gone through this and to have learned from it, and it's something that's going to stay with me forever. And I feel like I have this armor now that from it. And so I went into this conference thinking, I want to go in obviously to learn things, but I also want to network, and I want to figure out how I can get involved, and help somebody else. And so I went there and I met, so the woman who started this organization, this year was the 30th anniversary. So it was a really amazing, and they had folks from Harrisburg there that had helped with legislation to help, underserved patients, and, just all this important legislation. I thought, oh my God. So I left my name with the woman who founded the organization, and she called me. And so I told her the story. I said, I have to do something. So we're going to meet in November. And she said, I want to buy you lunch, and I want to hear your story, and I want to talk about how we're going to insert you into this. October, of course, being breast cancer month, is awareness month, is a bit busy, so we're going to let her get through it. But I'm super, super pumped about it. And then right after I spoke to many women there. And it was just really, really wonderful, and then I was shopping with my husband in Marshalls. And I wear a pin that I got from that conference, the ribbon, the pink ribbon. So the cashier said to me, "Oh, do you have breast cancer?" And I said, "Yeah." And she asked me, I said, "I'm currently in treatment, blah, blah, blah." And she said, "Well, what would you say to somebody who, is diagnosed, she's worried about losing her hair. She's worried, she's like losing her hair, and it's bothering her." And I said, I would tell her, she said, "I want to encourage her." And I said, I would tell her, that she should consider that her badge of honor as she fights through this war. And she said, "Oh, I think that's great." And she goes, "Well, would you do me a favor? Would you mind talking to her?" And she said, "She works here. She's in the fitting room. Would you mind talking to her?" So I went and I introduced myself to her. And so we had a conversation, and I talked to her. We talked about the hair loss. She said, "Mine's coming back." But I mean, it was a blow. I talked to her about that. But I told her, about how, I hated, I cried and cried and cried. I got to keep it real, but I got through it. And then it became not so bad, right? Because I've kind of wear this proudly now. And when I left from talking to her, I went out to my husband and I said, "This is what I want to do." And she hugged me when we were done, and she thanked me. And that's what I want to do. I want to share my story with people. I want to encourage people, because I don't want to say, "Oh, don't worry about losing your hair. It's no big deal." That's what I heard. Your hair is not you. But guess what? But guess what? I mean, I appreciated those words, but I bawled my eyes out. So, I mean, and I feel like, so I can legitimately come to somebody and say, "Yeah, it does hurt like hell to lose your hair." And you look in the mirror and you don't recognize that person. But here are the things, here are the things I got from it, and here's how I got through it. And so I think that would help me to help somebody else.
I love it. I love it. And it all started with the pen.
Yes. Yes.
That's amazing. That's
Hmm.
amazing. And I'm sure you shifted her life, just
Yeah,
by
I hope so.
having that conversation with her. So that is amazing. I love that. What
For
was
me,
some
it's my badge of honor that I've gone through this. Some people, I know my dad had cancer years ago and he didn't like, it was the C word, like you said, he didn't like to talk about it. And I feel like I can't keep it a secret because I was so encouraged by people sharing their stories with me when I was diagnosed. I love to hear somebody would say, like, I'm a 10-year breast cancer. I mean, I wanted to hear it. So I benefited from that. So I would have missed out on that if everyone kept it as their secret. I don't want to gatekeep it. I want to share it, you know?
Yes. What would you say to women out there who have breast cancer and they're not telling anyone? They're going through it by themselves.
Yeah, I would say that I think it's therapeutic to share it, right? Because when you bottle that up and you need to have an outlet for your fears, to even if just to share your thoughts, to be on the receiving end of somebody's kindness. I have to tell you, just the kindness of others has really touched me. And if I had kept it to myself, I would not have had those words. I have friends that check in and just want to call and they want to share something funny with you, give you something to laugh about or whatever. I think you miss out on all that, on what you can give to somebody else and also what they can give to you, when you just keep it all inside. And it doesn't, to me, I don't think it's healthy. It just feels so much better if you can share it and share a word with someone else. And then you find out about things from people that you might see, someone that you don't know went through the same thing as you, and by letting them know that you're in this war. And I feel like it is a war, and we are all we are all battling in this war, and we all have something we can contribute if we just speak up and speak out. So
Yeah, absolutely. And what I hear too is like you don't have to do it alone.
right.
You don't have to do it alone. It may seem scary, but you don't have to do it alone because as people, we need community. We need, family, friends. You need that hug. You need that person
Hmm.
to just have a good cry,
Hmm.
and you're not in it alone, even though you may feel like you're alone, but you're not alone. And I also like to say that, when you are diagnosed with cancer, it's life changing. So I think your identities get a little blurred because
For
who you
sure.
see yourself as, right?
Yeah.
I'm
Yeah.
not that person anymore. But then how do I show up? And then
Right.
so it's like all these things, but you don't have to go through it by yourself. And that's why I think it's so important to have like the social workers or a
Oh,
mental health professional there to help you kind of uncover different things. So that is great. Well,
it's like a
Valerie.
whole village. It's like a whole
Mhm.
village that you need to support you. Yeah.
Yeah. Yeah. How's your family dealing with everything? How are they doing?
Well, I would not have gotten through this without them. My daughter is married, and so she lives in Maryland. My son-in-law is in the army, but they were here a lot. I have to tell you, my rock was my husband. So it's just him and I. Only have one child. It was him and I, and he has seen the worst of it because he's here 24/7, and he has never missed an appointment. My friends have all come around and said, "Hey, chemo. You have chemo, we'll sit with you." And they would say to him, "You don't have to go every day. We'll sit with you and we'll sit with Valerie. You take a break if you want to go and get something to eat." And did not give up a day. When we were in the chair, he would not even leave. Like, the early days, I was easily there 6, 7 hours. And I would say to him, "Why don't you go somewhere and come back?" He would not budge. He would not budge. Middle of the night, screaming, throwing up, whatever. He was there. He was my rock. And even when I, was sharing with the mental health group about me being afraid that I was going to be a burden, he was inappropriately eavesdropping on my conversation. But he came to me and he said, "You will never be a burden. This we said when we said I do, we said, for better or for worse, sickness and health. And so we're going through it." And I feel like, yeah, we battled this together. Yeah.
I love that. I love that. That's amazing. I want to hug him.
He would deserve it. He deserves it. Yeah.
That's awesome. Well, Valerie, thank you so much for coming and
Sure.
sharing your story and shining the light on the importance of breast cancer awareness, diagnosis, treatment, support. Is there anything else you want to tell our listeners or viewers before we adjourn?
I just want to say, get your mammograms. Get your mammograms and encourage your friends. your relatives, make sure everybody does. And if you have to hound them, and even if they get annoyed with you, it's worth it, right? So that would be what I would tell folks to do.
Awesome. And Valerie, if somebody wants to reach out to you, how can they get in contact with you?
Oh, okay. Sure. Anybody that wants to talk to me, happy to talk. So they can email me or they can text me. I mean, what do you want me to share now here like this?
Yeah,
The-
or I can put it in the show notes, but they can email you. What's your email address?
yeah. So at work, I can't, I'm on medical leave and my computer is shut down. I can't do that. So it's my personal email for now while I'm on medical leave. So that is V as in Valerie, MC, P as in Peter, HE7104 at AOL, or they can text me and my cell is 610-299-1799. I almost always have my cell at my side. So, and I'm
Okay.
happy to talk to anyone about anything. I don't have any taboo topics. If there's something I haven't covered that somebody has a question about, I'm happy to share because that is what helps.
Awesome. Well, thank you so much. I know you're going to shift so many lives just by doing this interview here. So we appreciate it. And we'll definitely have to have you back.
Yeah, thank you for having me anytime. I mean, this is what I want to do, so
Absolutely. Absolutely. Thank you so much, Valerie.